Insurance. Does the development of the insurance industry promote the purchase of rural commercial health insurance? Depending on the reform of insurance companies and improving commercial insurance, potential capabilities become issue of important to natural strategy. They involve improving China's uh, social security system to analyze the deep started reason impacting in the purchasing behavior of commercial health insurance of rural residents in China. Using the D-Core model, this paper evaluated the development of China insure industry, insurance development of punching behavior of rural commercial health insurance based on the data of tracking survey project from China household and the careers to our imperials analysis. The result shows that the development of the insurance industry has obviously promoted the purchase behavior of commercial health insurance of rural residential. The research has significant participatory value on promotion of enjoying life of rural residential will also provide beneficial reference on the information and placement of future operation strategy in China's commercial health insurance companies. Introduction. Currently, China's economic development is shifting from an explore orientation to a democratic demand driven type, while the key and explained Timothy's demand is to effectively improve household concept in 290. The growth rate of China per capita developed income capita consonants 8.6 during the same time was which remained almost the same, while growth of savings per capita reduced to 8.7. This domestic Chinese residents come level in increasing rapidly. The consumer in relative was impacting residents. Medical insurance in Chinese society it's over 90%, and the rural society insurance system has entered the phase of normative development, which has played a positive role in increasing farmers' income, promoting farmers' corruption, consumers, and the harmony of rural families, and ensuring the elderly in rural area will be looked after. The social 1 and 2, however, due to residential factors such as low affordability levels, lack in policy coverage, and large difference in social security transfer payments, there are still some restriction in the potential fraction of rural social insurance system to address rural residential and families 3 and 4% not compensation 100% of income replacement only relying on social insurance system 5-7. Obviously it's a difficult helping rural more comprehensively and higher protection by only relying on social insurance system democrated by government 8-9. The 14th 5-year plan clearly highlighted the freedom and improvement of the social insurance system. The improvement of the insurance system is promotion of social insurance transfer and contribution, the development of unfined national social insurance public service platforms. Therefore, building a multi-tiered security system is necessary, made of important supplementality from commercial health insurance could play in a part of risk protection, labor management, credit, manufacturing privilege, and health insurance had the obvious as sparse multi-tiered security system. In 1013 it's necessary to improvise on of the head of accumulation of the population of commercial health insurance in rural areas. will help improve the safeguard function of commercial health insurance in rural area, which are significant in protecting rural residential production and life. In the recent years, there is number one central document issued by the North State Council, all mentioning an essential development of rural insurance industry, establishment and improvement of rural medical inspired system, active impression of protection messaging, virus insurance, and the basic medical needs of rural residents. 1415 as an important part of improving the society security system, the popularization of commercial health insurance, company safety, security, and risk investment, and the protest life and property right of the insurance as far as possible. Therefore, the area which close attention in building modularity and prosperous society in all expert rural assets of communication. China's April 2020 have 232 insurance companies in different areas in China, among which 97 are life insurance companies, which epidemic was a separate insurance service representing by life insurance companies activities and the meet its strong support in the impression or anti-epidemic work in 1670. However, due to rural impression, internal industry, and extreme environment, some of insurance companies paying too much employment in increasing, and some of insurance in rural residents and families with further reduce burden of caring of hardality and increasing medicine in life per rural residents. However, in the publicly rural insurance in filing the punishing behavior of commercial health insurance among rural residential deserve manufacture studies